Action of thyroid hormone on the reproductive system. The thyroid hormone support the normal menstrual cycle. It maintain the ovulation and the fertility in female and support the spermatogenesis and testosterone level in case of males. The thyroid hormones also modulating the hypothalamo-pituitary gonadal axis and enhancing the sensitivity of gonadal tissue to LH and FSH. The hypothalamus secrete the GnRH and which act on the interior pituitary and increase the release of LH and FSH. And these LH and FSH act on the ovary and result in increase the production of estrogen and progesterone. And it act on the testes and result in increase the production of testosterone. And this increased production of sex hormone by negative feedback mechanism inhibit the release of GnRH and ultimately decrease the level of LH and FSH in the blood and subsequently decrease the sex hormone production and secretion. So the thyroid hormone enhance the sensitivity of gonadal tissue to LH and FSH. So what happen in case of hypothyroidism? As in case of hypothyroidism, there is decrease the T3 and T4 level in the blood, and this decreased level of T3 and T4 result in increase the production of TRH from the hypothalamus. And this TRH act on the interior pituitary and stimulate the release of TSH and increase the release of prolactin. And this increased prolactin level inhibit the release of GnRH from hypothalamus and subsequently decrease the synthesis and production of LH and FSH. So in case of hypothyroidism, there is number 1, the menstrual irregularities. There is anovulation and infertility in case of females. Infertility in case of females. And there is decreased libido, erectile dysfunction, decreased sperm count, and in severe case there may be gynecomastia in case of male. So hypothyroidism result in menstrual irregularities in case of females and decreased sperm count, decreased libido and erectile dysfunction in case of male. So TSH does not inhibit the GnRH but increase the TRH level, lead to the increased production of prolactin. And with increased production of prolactin inhibit the GnRH and subsequently decrease the level of LH and FSH, cause the menstrual irregularities in case of female and decreased sperm count and gynecomastia in case of male. In case of hyperthyroidism, there is increase the T3 and T4 level, increased thyroid hormones, results in increase the production of sex hormone binding globulins. And these increased production of sex hormones binding globulins result in decrease the free level of sex hormone. As the increased production of sex hormone binding globulins, more testosterone and estrogen binds to these globulins and result in decrease the free level of sex hormone. And these decrease the free level of sex hormone, disrupt the feedback mechanism on pituitary. The hypothalamus secrete the GnRH and which act on the interior pituitary and increase the release of LH and FSH. And this increased production of sex hormone, so decrease the sex hormone level in the blood, lead to the increase the production of GnRH and subsequently increase the production of LH and FSH. But keep in mind that the GnRH always release in a pulsatile manner. Means that GnRH is not released continuously but rather in small pulses at a regular interval. So increased GnRH Due to decrease of free level of sex hormone, there is disruption of pulsatile GnRH release. So there is number one disruption of pulsatile release of GnRH. Because of decreased pulsatile release of GnRH, increased GnRH level which are not pulsatile this cause the desensitization of GnRH receptor on the anterior pituitary. Because of desensitization of GnRH receptor on the anterior pituitary, there is impaired FSH and LH release. So there is impaired LH and FSH secretion despite high GnRH. So because of impaired FSH and LH release in case of female, this cause the oligomenorrhea or amenorrhea. This cause the infertility, increased risk of spontaneous abortion, and in case of male it cause decreased sperm motility, decreased libido, and erectile dysfunction due to impaired FSH and LH secretion despite high GnRH level. And secondly, because of abnormal GnRH pulses cause the abnormal LH and FSH ratio in blood. So there is disorganized LH and FSH ratio. Because of abnormal GnRH pulses, there is abnormal LH and FSH ratio in blood. Similarly, we seen this kind of situation in case of PCOS, where the production of LH is more than the FSH. Because of the increases of LH to FSH level, this caused the anovulation. And because of androgen excess, there is hirsutism in case of PCOS. So in case of hyperthyroidism, there is disorganized release of sex hormone in case of male and females. In female, it causes oligomenorrhea, amenorrhea, and fertility, and increased risk of spontaneous abortion. And in male, it causes decreased sperm count, decreased libido, and erectile dysfunction. This is again because of number one, the disruption of pulsatile release of GnRH, and second, because of disorganized LH to FSH ratio. So this is the effect of thyroid hormone on the reproductive system. And now the effect on heart because of increase in metabolic activities like increase in BMR and their increase in sympathetic overactivity, and also the direct effect on heart. That is, it increased the beta adrenergic receptor expression by the thyroid hormones because of increased metabolic activities, sympathetic activities, and direct effect. The thyroid hormone leads to increase in heart rate, increase in contractility, increase in stroke volume and cardiac output, and ultimately leads to increase in BP. So what happens in case of hyperthyroidism? In case of hyperthyroidism, there is number one, exertional dyspnea, as there is increase in BMR. Because of increase in BMR, there is increased oxygen need even in case of rest. So there is increased oxygen need at rest. So this demand increase even more during the mild exertion, so making the body starve for oxygen supply. So this result in shortness of breath even with mild activities. And also there is increase in heart rate and increase in cardiac output, so there is tachycardia. This helpful initially to meet the oxygen demand. But over time can lead to high output heart failure. The heart becomes less efficient to meet the oxygen need during the exercise, and this even increase the shortness of breath and fatigue. So there is exertional dyspnea because of increase in BMR and increased oxygen demand even during mild exertion. And also because high output heart failure, there is decreased oxygen supply during exercise, and this add more fatigue and shortness of breath during exertion. Second, there is palpitation because of increase of heart rate, increased risk of angina because of persistent tachycardia. There is high output heart failure, and because of increase the workload of heart, there is increased risk of cardiomyopathy, especially the left ventricular hypertrophy because of increase of workload of heart. And what happened during the hypothyroidism? During hypothyroidism, there is the bradycardia. There is decreased cardiac output and decreased stroke volume, and ultimately lead to decreased blood pressure, and also the pulse pressure is decreased. As in case of hyperthyroidism, there is increased BMR and there is increased production of heat in the peripheral tissue, and to dissipate this excess heat, the body causes cutaneous vasodilation. So there is vasodilation to dissipate this excess heat, and also in vascular endothelial cells, there is increased production of nitric oxide by the direct effect of T3, and there is increased production of nitric oxide in the vascular endothelial, and this nitric oxide causes smooth muscle relaxation, and this also causes vasodilation. So because of cutaneous vasodilation, there is warm, moist skin. There is bounding pulses because of rapid ejection into the dilated arteries, and there is wide pulse pressure because of cutaneous vasodilation. And in case of hypothyroidism, because of decreased BMR, there is decreased heat production, and body conserve this heat by vasoconstriction, and also there is impaired nitric oxide mediated vasodilation, so also result in added vasoconstriction. And because of vasoconstriction, there is pale, cold, dry skin, and also there is fatigue and increased risk of cramps because of vasoconstriction. And this is the effect of thyroid hormone on the heart.